Moving on for now, a deepening health crisis is unfolding in Sudan's capital, where more than 2,300 cholera cases have been reported in the past 3 weeks alone. The country's Ministry of Health saying that at least 51 people have died as fighting continues to cripple basic infrastructure. 90% of these cases, in fact, have been reported in and around Greater Khartoum, particularly in Karari and Jabal Olia, areas now at the epicenter of the humanitarian emergency. The surge in cholera cases comes amid Sudan's devastating civil conflict, now in its third year. As the Sudanese army asserts full control over Khartoum state, continued drone attacks have left power stations, fuel depots and even dams in ruins, creating conditions for the spread of cholera, dengue fever, malaria and other diseases. The United Nations warns that public services are under enormous strain, leaving millions of people vulnerable to preventable illness and death. The Sudanese army blames the paramilitary rapid support forces, or the RSF, for much of the destruction, particularly drone strikes deep inside government-held areas. And as the violence drags on, civilians continue to pay the highest price. Aid groups are calling for immediate humanitarian access to prevent an even wider epidemic.
With accusations and counter-accusations over the recurrent attacks targeted at facilities in Sudan, the adverse effect has seen over 2,000 people down with cholera over the past 3 weeks, according to Sudan authorities. Recent drone strikes by the rapid support forces have severely damaged power stations, leading to widespread blackouts and water supply disruptions across Khartoum and other regions. In White Nile State, the situation is there. A missile strike on the Rabat power plant February 2025 crippled water pumping stations, forcing residents to rely on unsafe water sources. This has resulted in thousands of cholera cases and deaths recorded, including children. The outbreak has overwhelmed healthcare facilities, with patients receiving treatment on hospital floors due to overcrowding. Now, humanitarian organizations are intensifying efforts to combat the outbreak by providing emergency water supplies, medical treatment. However, ongoing conflicts and attack on infrastructure continue to hinder these efforts, putting countless lives at risk. From Lagos, Nigeria, Louisa Olani, WION.
To stay up to speed with the latest news, download the WION app and subscribe to our YouTube channel.